Good afternoon, Dr. Angrist. Can you introduce yourself to the ladies and gentlemen of the jury today?
My name is Alice Angrist.
And what is your profession?
I'm a pathologist.
All right. And what is that?
A pathologist is a physician who studies tissues to see what the changes in structure or function, how they are related to disease states.
Okay, all right. And where did you go to school for that?
I got my bachelor's in biology from the University of Wisconsin, and then I went to the University of Chicago Medical School.
Okay, what years were those? When did you graduate?
I graduated from medical school in '76.
Okay, all right. And did you have other training after that?
Then I had a year's internship at Northwestern in pathology,
Okay.
and 2 years residency back at the University of Chicago,
All
also
right.
in pathology.
Great. And do you have any certifications, anything in that area?
I'm a diplomat in pathology, and I'm qualified in morbid pathology and clinical pathology, as well as forensic pathology.
Okay, all right. Can you explain a little bit specifically with the forensic pathology? What is that?
Forensic pathology is using the skills of pathology in legal proceedings to help with investigations.
Okay, basically what we're doing today.
Exactly.
Okay. In your field of study, in your experience, you've been a practicing physician, a pathologist since you graduated?
Yes, for 21 years since my residency.
Okay, all right. In that 21 years, have you had very much, and even before in your internship and residency, did you have very much experience with gunshot wounds as you're working with your forensic pathology?
Yes, working here in Cook County, I've seen a lot of gunshot wounds.
Okay, and you have experience with looking at the wound, the entry site of the bullet, and different things, and being able to figure out angles from the gunshot and different things like that?
Quite often you can, yes.
Okay, great. Let's go ahead and move specifically to today's case. You're familiar with my client today, Mr. Robert Ramirez?
That's right.
You've met him before?
Yes, I have.
All right, when was that?
That was 3 years ago, March of '97, when he came to my office.
Okay. And did you do a physical exam with him then?
I did.
All right. And did he talk to you about his injuries?
Yes, he did.
All right. What did he tell you?
He told me that he was shot while he was lying on the ground and attempting to get up.
Okay. And when you said you also did a physical examination of him, did you see the wound?
Yes, I saw the scar that was left from the wound.
Okay. All right. So he had already healed from it.
Nearly, yes.
Okay. All right. And was there anything remarkable about the wound, or the scar rather?
Only that it was larger and had irregular edges compared to what one would have expected from a more common gunshot wound.
Sure. And were you able to review any of his medical records?
Yes, I did. I saw all of his hospital records.
All right. What would that include?
His emergency room, admission records, examination records, his surgical record, and his discharge summary.
All right. And based off of the information that you have about Mr. Ramirez, what he told you, your physical examination, and reviewing his medical records, have you been able to come to your own opinion on how he received those injuries?
Yes, I have.
Okay. Let's go ahead and go into that specifically a little bit. You mentioned the size of the wound when you did your physical examination. Did you can you explain what that told you?
Well, the record shows that that there was a distance of 3 feet.
Okay.
And ballistics for a .38 caliber bullet at that distance would typically be smaller and completely round.
Okay.
The fact that it was larger and had the irregular edges tells me that the patient was moving on impact of the bullet.
Okay, all right. And does that confirm what Mr. Ramirez told you about he's attempting to get up off of the ground at the time?
It corroborates what he said, yes.
Okay, all right. Have you, in the medical records that you read, was there anything in there that also confirmed that?
Well, the medical records also stated that it was irregular in shape and gave the size of the entrance.
All right. Also, in the medical records, were you able to come to an opinion about the angle of the injury?
Yes, I could.
You did, okay. And what was the information that helped you come to that
Well, in
conclusion?
the surgical record, it said where the bullet was found, and that helped me to determine the angle or the pathway that the bullet took through the body.
Okay. And what was that information specifically?
The bullet entered through the right shoulder.
Okay, can you point on yourself for exactly where
Okay,
that
it would have
was?
been back here.
Okay.
And went down, and it was the bullet was actually found in the wall of the heart near the center of the body, but considerably lower. And so you could see that there was a diagonal slant going across the body,
Okay.
as well as going downward.
All right. And what does that tell you about the angle of the shot?
Well, the angle of the shot appears that it would have been downward because of the way that the bullet went through the body.
Okay. Was there anything else in the records that indicated the path of the bullet?
It did say that the scapula was nicked, that's the shoulder blade.
Okay.
And that could have diverted the angle slightly, but it wouldn't have made a large difference.
Okay, so it's your opinion that that the shot came from above the shoulder at a downward angle. Is that right?
That would certainly be plausible, yes.
Okay, all right. Is that consistent with what Mr. Ramirez told you about when he was attempting to get up off the ground?
Yes.
Okay, all right. Let me give you a hypothetical just to see if whether you're able to render your opinion on. If Mr. Ramirez, rather than getting up off of the ground, if he were already standing up and maybe raising his arm, would the information be consistent with that when he was shot from 3 feet away?
It would have been, the scar would have still been irregular if he was moving at the time, if he wasn't standing perfectly still.
Okay, what about the angle of the shot?
Unless the shooter was extremely tall, it would be hard for it to go downward through the body as it did.
Okay, all right. So your opinion is that Mr. Ramirez's story of getting up off of the ground is consistent
With the findings,
with
yes.
the findings? Okay. Thank you very much. I have no further questions.